I'd like for everyone to think for a moment about the value of human life. And does one person's life have any more value than another person's? The current fee-for-service healthcare system rations out care based on the patient's ability to pay. I believe this is unethical. It is criminal. 95% of the country is still functioning on this fee-for-service model. I believe everyone should be treated the same. Everyone should have access to primary care regardless of their ability to pay. Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is a COVID update. My co-host and moderator of the chat is Dr. Dan Mccarter. Welcome, Dr. Dan. How are you doing?
I'm doing great, Faisel. It's good to be with you again this evening.
It's good to be back. I wanted to first start off by thanking Dr. Say Solomon. Dr. Say Solomon, thank you so much for coming in pretty much at the last minute. Close. He was on warning. My dad was in the hospital and he's recovering. He's doing very well. And I just appreciate how Dr. Solomon was able to come and host the show last week. I'll forever be grateful. And Dr. Dan, you, Drew, Jess, I'm so appreciative to you all for just keeping this moving.
Absolutely. At least I've been where you are, and I think I speak for Dr. Solomon when I say we both wanted to do whatever we could to help you, and we were happy to help out any way we could.
Oh, I appreciate it so much. And to many of the listeners, I appreciate all your prayers. We literally received thousands of prayers from all different people from all different backgrounds, all different cultures, different religions, even some people who were atheists who were saying, hey, we're just sending good vibes. And we accepted, we received them all, especially through the hard times. I actually read them to my father when he was going through his hard times, and it really helped encourage him to push through. So thank you very much. Well, let's get on with the show. Dr. Dan, you and I both know that the COVID-19 vaccines work, but try telling that to half the country. I'm so thrilled to have ChenMed's own Dr. Jason Lane joining us tonight. Jason, welcome back, and thank you for coming to give another COVID update. And actually, let me rephrase that. I'm sorry that you're back having to give another COVID update. We were hoping that this was going to be like the victory lap tour.
Right. I think Jason is having some audio difficulties, but yeah, absolutely. I think when we scheduled this, we were really thinking about that this was going to be an issue, talking about COVID in schools and masking versus not masking.
Yeah.
We thought that the vaccines had pretty well moved things down, but now we're seeing rises. And, I saw that I think it's New Orleans has more people in the hospital now than they have at any point during the COVID pandemic.
My goodness. Yeah. I remember feeling so optimistic with all the different vaccines becoming available and the case numbers moving in the right direction. People started traveling again. We started visiting with each other again. Things just started feeling right. Like the end felt like it was in sight. I mean, I was going to ask Jason, and we can ask Jason when he comes back on. Jason's had some technical difficulties, but Dr. Dan, what do you think? What do you think some of the things happened? Like, why is it that we're in this situation?
Well, we all started traveling. When was it? Back in May.
Yeah.
And I remember taking the flight to Miami, and lots of empty seats on the planes, very easy walking through the airports, very few people there. But then in June, my family made a trip out to Colorado, and the airplanes were packed. The Denver airport was packed. All of the zoos, all of the sort of tourist areas were completely packed. And I think we just everybody was tired and wanted to get out. And there was still a number of people that weren't vaccinated. And I think that just sort of started spreading it along. I think what we're seeing now with the immunity levels are that immunity seems to wane over time from the immunizations, and that's coming up with the CDC's recommendation to have another booster dose at this point as well. So I think there are a number of things. I mean, looking at some numbers today, it looks like the even sort of worst case right now, the vaccine is providing 81% protection against hospitalizations. If a year ago somebody had told us that they had a vaccine that was 81% effective, we would just be jumping for joy, right?
That's right.
I mean,
That's right.
and now we're upset. Well, it's dropped from 95% to 81%, though I'm sure we'll get it back up when we start doing the additional doses as well.
You know, I agree. I also worry about so many people around the world who still haven't received their first dose of the vaccine.
Right.
And with COVID festering in these places and how connected the world is these days, I mean, of course, we have to overcome vaccine hesitancy here in our country, but with but with the pandemic still continuing in places where they haven't received, entire communities of people who haven't received the first dose yet, I worry about what will come of all these variants and the mutations.
And if Jason has audio, I think that he's a much better person to be speaking about that than I am.
I'm not sure I have audio. I'm also not sure I'm a better person to be speaking about it. But can you hear me?
We can hear you.
Oh, good. I'm so
Well,
sorry
Jason,
about that. I was having difficulty with my speakers there, but I think we're good now.
Yeah,
we are.
that
We are.
that's the fun of doing this live, if you call it fun.
Yeah. So, Jason, we were just talking about how it felt so good just a couple months ago. We were all feeling so optimistic with all these vaccines becoming available, case numbers moving in the right direction. It all felt like we could feel the end was there. And now, what in the world happened?
Gosh, I've been thinking about this a lot. Right, just 8 weeks ago in June, it felt like it felt like it was kind of over, right? And it was almost like a feeling of euphoria. And then
Yeah.
for me, being down here in Florida, I think the first trouble signs showed up just a little bit before the 4th of July. And then it really started to take off in early to mid July. And then by the end of July, I really realized that we were in trouble again. And it felt a lot like it was March 2020 all over because things were moving incredibly fast. And they've continued to move incredibly fast right up to today with, bad news as far as Delta variant getting worse, but also I think good news with the realization that boosters are necessary, which I take as a good thing because we have the tools that we need to deal with this, and things are getting mobilized so that we're going to be able to use them. So just lots of moving pieces right now, kind of tough to stay on top of. I'm sure it's confusing to me. I'm sure it's confusing to to everybody. But yeah, it's kind of it's like, what's that saying? Trying to drink water through a fire hose, right? Is kind of how it
That's
feels
right.
right now, and staying on top of this.
But one of the things that concerns me so much is that around the world there are still entire communities of people who haven't received their first vaccine yet. And I worry about these populations of people not being vaccinated and how connected the world is. Still, people are traveling. I mean, what apart from restricting travel, I mean, what else can we do?
I think the answer is we have to do a better job at vaccine equity, at making sure
Hmm.
vaccines are available to everyone. But logistically, it's probably not realistic until we get into 2022, which means,
Mm.
I was thinking back to June. Let me think back to just May. We were also getting that feeling of euphoria, but there were these news reports about this Delta variant over in India, right?
Right.
And I was for some, I think maybe I didn't want to believe it was going to be a problem. I think what it really is, at that time we were still vaccinating a lot of people every day. I think we were down from our peak of 3 million a day, but we were still vaccinating between 1 and 2 a day. And I thought that we were going to vaccinate ourselves into a situation where new variants weren't going to be a problem for us. But vaccination fell off a cliff. We left ourselves very susceptible to what was going on around the rest of the world. And here we are. Now, I actually don't think, given what we're learning about Delta, I don't think that staying at that same vaccination pace would have left us completely immune to Delta. But I think it would have meant that we wouldn't have seen anything like what we're dealing with now if we'd stayed on that pace.
Yeah. And sadly, we still have millions of people who are choosing to ignore like just reliable research, like basic medical advice, like washing your hands, even wearing a mask. I mean, it continues to be politicized. I mean, this is August 2021. I mean, it, quite frankly, it's killing people. Like, why do we continue to still have all these vaccine myths? I got a new one. I was telling Dr. Dan earlier today about getting the vaccine, and it could change your DNA to look more like a chimpanzee's than a human. I mean, that was today. It came out of Russia.
I think a lot of them feed on fear, right? Fear is a very powerful emotion. I try to keep an open mind to it, and understand that our job as medical professionals, even as just community members, as family members, is to, as hard as it might be, is to not blame people who become susceptible to the rumors and the, I'm going to say disinformation that's out there, because I think some of it is, you mentioned the one today came from Russia. I think some of it is very, very malignant and intentional. Approach all those people from a perspective of love and caring, and continue just to try to engage, to bring them along to be able to take advantage of this really important, and I'd say even miraculous health intervention that we have in these vaccines.
Yep. So we've actually got some good questions coming in, and I'll just probably bring them up in the order that they're in. Joel Jackson is bringing up a question: is there a comparable viral illness we can use to assess long-term implications of COVID, or really, what should primary care be planning for to treat the lingering and chronic symptoms?
That's a great question. Thank you. I don't think we know. So I think you're referring to long COVID. I don't think we know yet exactly what long COVID is, or exactly how it's triggered. It very well might be more than one thing. It's not unusual for all sorts of viruses to trigger some more prolonged symptoms. Even there's a lot of thought that chronic fatigue syndrome is often may be related to or be triggered by a viral infection. So there's a lot of similarities out there, but those things that it's similar to also aren't extremely well understood. So I guess I mentioned keeping an open mind, and approaching people with ongoing vaccine hesitancy, from a compassionate perspective. I think that's what we have to do with the patients with long COVID, is keep an open mind to what they're experiencing, and approach it also from a place of compassion and caring and trying to heal.
Right. I think that's great advice, since especially be very reluctant to tell somebody that it's not real, because there's so much that we don't know about it at this point.
Sure.
Henry brings up a good question. He says, what's the risk of the virus mutating to bypass the vaccine's effectiveness at stopping hospitalization and death? And I mean, I think we're already starting to see some drop in effectiveness. But what do you think the odds of it coming up with a lambda or a omega variant or something that would be much more severe than the Delta variant is?
I've taken to saying that I'm getting out of the prediction game with this virus. So I'm not going to give it a percentage. I mean, I've definitely been wrong many times. A lot of us have.
Yeah.
But it's certainly possible, and getting back to your question about, all the unvaccinated people in the world, that's the risk, right? If we only look inward and only care about protecting ourselves, as a country, or maybe as developed nations with the capabilities to produce vaccines, then it's still going to circulate among all these other populations. And as it mutates and evolves, there's definitely a chance that something worse than Delta is going to come up. In fact, you asked about Lambda. I can tell you with 100% certainty there will be a Lambda, because there is. And there is concern that that one is more vaccine resistant than Delta. It's not very widespread yet. In fact, I don't have any. I'm thinking so much about Delta. I don't have any brain cells to give to Lambda to think about it. But from what little I've read, it has popped up a few places in the U.S. so far, and that is the concern, that it's the next one that's even more vaccine resistant. So I think it gets back to figuring out, how to get over vaccine hesitancy in this country, right, where we have enough vaccines for everyone. So that's one problem they have. We have plenty of vaccines. We just don't have enough people willing to take them. And then the other problem is, the vast majority of people in this world who don't have the vaccines available to them. And I think we need to be able to focus on both problems. And from just an altruistic point of view, we should want to help everybody access the vaccine, but also from a selfish point of view, if that's how you approach things. Because if you want to keep yourself safe, one of the best ways to do it right now is to make sure everyone around you is safe. And now that you can fly halfway around the world, in less than a day, that means protecting everybody. So I guess we have to do a better job at both. And that's the way to get ahead of these mutants, and make sure they don't have the ability to grab a foothold like Delta did and become such a problem.
And then Art asked the question. He said, I've been vaccinated and got COVID recently. He received monoclonal antibody infusions and wanted to know how long after the monoclonal infusion can he get the third vaccine. Do you know what the waiting time is recommended there?
I assume it'll be the same as after the first or second vaccine, which is 90 days. So there aren't any specific recommendations for how to approach it after a third dose yet, but I'm pretty sure it'll be the same 90-day wait. And that's just to basically give time for those antibody levels to wane in your blood, which will then allow your body to respond more normally to the vaccine.
With what you mentioned with vaccine, one of the hurdles, obviously, we must overcome vaccine hesitancy. I'm getting calls from many of the no's are finally turning into yeses. One of them, my own aunt in Pennsylvania, who was very hesitant, finally called me and said that she got her first dose of the COVID vaccine last week. And for a good chunk of the no's, this is obviously a very big deal. It's definitely not just a matter of knowing that something is right or wrong. I feel that for many people, this has become much more of an emotional hurdle. So, what's your advice to healthcare providers with overcoming hesitancy, vaccine hesitancy?
I think that my biggest piece of advice is to not give up, because you never know when a patient may have, maybe had a family member come down with COVID, maybe seen something about the latest surge that has them thinking, seen one of the stories about the unvaccinated people that's all over the place right now who are in the ICU and saying, oh, I wish I'd gotten the vaccine. We're in a really difficult spot with the vaccine hesitant right now because it's hard. I have a number of patients in my own panel that I cannot convince to get vaccinated. Two of them ended up in the hospital last week.
Oh.
So, when you ask for my advice, I don't have I don't have a magic answer where I know that if you tell them this, they will say yes. I don't think that answer exists. But what I do know is if you run out of steam and you stop asking, then you're not going to get to yes with them. So continuing to give them the opportunity to think about it and say yes, I think is the most important part. And then from there, I think let's take the approach that we recommend for our docs at ChenMed. And it starts with, an evidence-based approach that really comes out of pediatrics to give a really strong recommendation up front. Hey, Mr. Jones, this is the day you're getting your vaccine. It's really important. Let's go do it. But a lot of folks at this point are going to say no and have already said no to that. Then we teach motivational interviewing, right? Which teaches you to, with real curiosity, explore the patient's beliefs, explore like what their goals and desires are, and then help them see how this vaccine is going to help them reach that. That's time consuming. It takes a long time to sit down and have that kind of conversation with the patient. And it's certainly not foolproof. It's definitely difficult and it takes time. But I can't think of a medical intervention we have, that takes, a couple seconds and is available in doctor's offices right now that's as likely to save a life as the COVID vaccine right now. I know, Dr. Dan, you're really good with these numbers. What do you think about that?
Yeah, no, I mean, just back of the envelope calculations, it looks to me the number needed to treat to prevent a hospitalization is somewhere around every 300 people you immunize, you'll prevent a hospitalization. So that means if 100 million Americans aren't immunized, if we got them immunized, that would save about $5 billion. And I know we throw around trillion-dollar numbers, but $5 billion is not chicken feed, right? I mean, you could build some bridges or we could do some pretty cool things for schools with $5 billion. So, and that's just having a conservative estimating $15,000 per hospitalization. I mean, a lot of people will wind up in much longer periods of time. And the other issue is with 1 in 5 Americans already in medical debt collection.
Exactly.
I mean, if you wind up getting hospitalized with COVID in an ICU, it's not going to help your financial situation. I mean, you're not going to be able to work during that period of time, and you're going to run up some very big bills. So, getting vaccinated would make a huge difference in decreasing that risk.
Yeah, I agree, and I still can't believe that it's August and we're still
it's
having this.
definitely worth the time.
Oh, sorry.
That's okay. I was just going to say it's definitely worth the time invested. Did you guys lose me?
We lost you there just for a few moments.
Yeah, I'm going to channel Jason and say that he was saying it's definitely worth the time invested. There are very few things in healthcare that we can do that have a number needed to treat like that to prevent hospitalizations.
Well, I agree, and I think now would probably be a good time for us to go to a commercial break. We'll take a quick break for 20 seconds, and then we'll come back and wrap up some final thoughts with Jason with a COVID update.
ChenMed honors seniors with affordable, top-of-the-line care, and we're expanding. We're opening 25 new centers this year, including centers in 2 new cities, Houston and Detroit. Join us as we bring better healthcare to more seniors. Head to chenmed.com/physicians for more information.
And we're back. So, Jason, what are your final words? We'd like to close out the show tonight with our COVID update. We have I have an 8-year-old in elementary school. They're doing a pretty good job. with keeping the kids masked up and keeping the distance and have hand sanitizer all over. The teachers are watching them. But I worry about what happens in the cafeteria. No kidding. Today I was even debating sending him to school with like a protein shake, so he wouldn't be eating the turkey sandwich and taking his mask off for prolonged periods of time. What are some of your closing thoughts for COVID update, and then we could wrap up tonight's show.
So Faisel, I think Jason looks like he lost his connection. It looks like he's on his way back. So,
well, until Jason comes back, and this is what happens when we're live. I would say,
I am back.
Oh,
Sorry,
you're back.
Can you guys hear me now?
Yes, we can.
Hi, sorry, I had trouble with the audio. Looks like there's a delay in what I'm saying coming through.
It feels like it's better now. I was saying that, for your closing thoughts, we've got the kids are back in school. My oldest is in middle school. He's vaccinated. I have my 8-year-old is in elementary school. He's still not vaccinated. I've got my 3-year-old. He's not vaccinated. I feel pretty good with the schools trying to do whatever they can with keeping the kids safely distanced and having hand sanitizer readily available. The children are wearing masks. But I worry about what happens in the cafeteria. I've even thought earlier today about sending my son with a protein shake so he could have minimal time with his face uncovered. But my family thought that was overkill. So what are some of your closing thoughts for tonight's COVID update?
I think in the cafeteria, when I dropped my 4-year-old off at preschool this morning, they asked me if she had school lunch. I said yes. They said, well, no, she doesn't, because the cafeteria staff is out with COVID. So you need to go to the supermarket and buy her lunch. So that's how my day started today. I think schools are gonna be rough. I expect with Delta the way it is, if you're in an area with a Delta surge, expect school quarantine and closures. So I think it's going to be tough on people again for the next couple months. But I'm actually really optimistic today. So again, it goes back to the news about additional vaccine doses being authorized for immunocompromised just last week. And now there's news that boosters are for probably most Americans sometime in mid-September. So I'm optimistic because I know we have the tools to take care of this and to keep people healthy. And we definitely have work to do in convincing some of the hesitant. But it's a much better place to be than it was a year ago, right? It's frustrating because we didn't expect to be here right now. But a year ago, when the vaccines were approved, we didn't know if they were going to be very effective. They're approved. We have them. There's a bump in the road with the need for a booster and some of the variants, but it's okay because we have the right tools and we're going to have them available to use. It's just going to be a little more work, right? And a little more time than we thought it was going to be. But still, if you go back, if you think when this started, for it came on people's radar end of February to early March 2020. At that time, the fastest a vaccine had ever been developed was 4, from development until approval and use was 4 years, right? So that wouldn't have to do anything for this pandemic. We were probably looking at the pandemic last 2 or 3 years at least, and burn through a significant portion of the population before getting to natural herd immunity. To be where we are now with effective vaccines, and just the right tools to keep people safe from this is a much better place than I think a lot of people thought we would be when this all started. So I guess I close by saying I'm optimistic, despite what we're facing with Delta and everything right now, I'm very optimistic. And I would just encourage everybody to stay to and protecting patients, stay flexible, agile, because this probably won't be the last bump in the road. There may be a few more, but keep heart and know that there's a very strong light at the tunnel, and the tunnel's getting shorter.
Thank you so much, Jason. Thank you with overcoming some of the technical difficulties, and thank you for such a nice close to tonight's COVID update. I feel optimistic after hearing your final closing remarks. And Dr. Dan, thank you so much, as always, for moderating the chat. Our audience, thank you as well for joining us. For more information about tonight's topic and to explore career opportunities with ChenMed, remember, we're on track to open another 500 centers. We're on track to open another 500 centers over the next 4 to 5 years. If you're interested in learning about career opportunities with ChenMed, just think about the doctors we're talking about to fill those centers. You're talking another 2,000 to 3,000 doctors, plus all the teams, support teams to take care of those doctors. Please visit chenmed.com. We believe access to primary care is a right, not a privilege.